With permission, Mr. Speaker, I would like to make a statement on the medical use of cannabis. Over the weekend, I issued an emergency licence to allow Billy Caldwell's medical team to access cannabis-based medicine to treat life-threatening seizures caused by a severe form of epilepsy. This was an emergency procedure which was led by a senior clinician with the support of the medical director at the Chelsea and Westminster Hospital. I'm pleased to say that Billy has now been discharged from hospital. It is now for his senior clinicians to develop a long-term care plan. I'm sure the whole House would like to join me in expressing the sympathy of all of us for Billy and his family for what they have been going through, the very difficult time that they have faced. The course of action in this case was, of course, unprecedented. There is strong scientific evidence that cannabis is a drug which can harm people's mental and physical health and damage communities. There are currently no legally recognised medicinal or therapeutic benefits. To date, under successive governments, Home Office policy has been to permit the production, supply and possession of raw cannabis solely for the purposes of research with a Home Office licence. The cannabis-based medicine Sativex can, however, be prescribed in the UK because there is a proven case for its safety and its efficacy. However, cases like Billy's, Alfie Dingley's and others like it have shown that we now need to look more closely at the use of cannabis-based medicines in the healthcare sector in the UK. Because it has become clear to me since becoming Home Secretary that the position that we find ourselves in currently is not satisfactory. It's not satisfactory for the parents, it's not satisfactory for the doctors, and it's not satisfactory for me. I've now come to the conclusion that it is time to review the scheduling of cannabis. Before I go into any detail in the review, let me be absolutely clear that this step is in no way a first step to the legalisation of cannabis for recreational use. This government has absolutely no plans to legalise cannabis, and the penalties for unauthorised supply and possession will remain unchanged. We will not see a dangerous president or weaken our ability to keep dangerous drugs off our streets. The approach that we will be asking the review to consider will be no different than that has been used before for controlled drugs where there is evidence of medical benefits. The government review will take place in two parts. Part 1 of the Commission will consider the evidence available for the medicinal and therapeutic benefits of cannabis-based medicines. Professor Sally Davies, who also serves as the Chief Medical Officer, will take this part forward. This would then inform exactly which forms of cannabis or cannabis-based medicines should be taken forward in Part 2. Part 2 will be led by the Advisory Council on the Misuse of Drugs. The ACMD will not reassess the evidence issued by Professor Sally Davies, but will provide an assessment based on the balance of harms and public health needs of what, if anything, should be rescheduled. If the review identified that there are significant medical benefits, then we do intend to reschedule. We have seen in recent months that there is a pressing need to allow those who might benefit from cannabis-based products to access them. It will, of course, take time for Sally Davies and ACMD to complete their work and for the government to consider their recommendations. In the short term, the Policing Minister announced yesterday that the government will be establishing an expert panel of clinicians to advise ministers of any applications to prescribe cannabis-based medicines. This is intended to ensure that advice to ministers on licensing in these cases is clinically led, that it is based firmly on medical evidence, and that it is as swift as possible. The Chief Medical Officers across the UK have been actively working together already on this panel, and the expert panel will start considering applications within a week.